Conventional stroke medicine asks one question: did the clot dissolve? Functional medicine asks a completely different question: does the brain have everything it needs to actually heal? Those two questions lead to very different outcomes. Today I'm going to show you what functional medicine sees that standard care is missing and give you a real plan that you can act on today. My name is Dr. Clarke. I'm a board-certified physical medicine and rehabilitation physician. I'm also a Ph.D. neuroscientist. I've spent 40 years on hospital rounds with stroke and brain injury patients, and at the same time, I've been reading and contributing to the basic neuroscience research literature. My tagline says it simply: chemistry plus therapy equals function. Let me take you through the lens that changes everything. Because once you understand how a functional medicine doctor thinks about stroke, you'll never look at a standard discharge summary the same way again. Here's the core difference. Conventional stroke care is brilliant at the emergency phase. It will dissolve the clot, stabilize the blood pressure, and get you into rehab. That's genuinely life-saving work. I'm not criticizing it. But here's the question it almost never asks. Once the emergency is over, does the patient's brain have the biochemical resources to actually repair itself? It turns out that the answer for most stroke survivors is no. Not because the brain has stopped trying, but because the very resources the brain needs to rebuild are either depleted by the stroke itself or have never been measured in the first place. Functional medicine starts right there. It says, what does this person's individual chemistry look like? What's missing? And what does the research say about how to restore it? To understand why this different approach matters so much, you have to understand what happens inside the brain in the weeks after a stroke. A stroke creates what I call a supply crisis in the brain. When cells die, they release destructive chemicals. Those chemicals kill more cells. And healing that kind of damage requires enormous amounts of specific nutrients that the body now has to redirect towards the brain. The problem is that standard post-stroke labs do not check for these nutrients. They check for your hemoglobin. They check your kidney function. They do not check your CoQ10, which is the primary molecule your neurons use to make energy. They do not check your omega-3 fatty acid status, which is critical for building new cell membranes. They do not check your neurosteroid levels, which are the hormones that tell your stem cells to become new neurons. You cannot do a basic lab panel and expect to find the deep deficiencies keeping the brain from healing. And when you actually look at what those deeper labs reveal, some of what you find is genuinely surprising. Through a functional medicine lens, stroke survivors often share predictable patterns of biochemical gaps. And knowing this pattern is actually useful because it tells you where to focus. CoQ10 deficiency is nearly universal. CoQ10 is like the spark plug in the engine of every neuron. Without it, the mitochondria cannot produce enough energy for the cell to function, let alone repair. Research published in the Ochsner Journal showed that statin medications, which many stroke patients are prescribed, actively deplete CoQ10. So you have a brain that needs more energy on a medication that reduces the molecule it uses to make that energy. Omega-3 fatty acids are typically low. About 60% of your brain's dry weight is fat. Much of it is DHA, a long-chain omega-3. When you rebuild a damaged cell membrane, DHA is a primary structural material. If you're deficient, the new cells you're trying to build are going up without enough of the right material. That matters enormously for recovery. Beyond the nutrients, functional medicine also asks a question that standard neurology rarely considers. What role is chronic inflammation playing in this person's recovery? Here are 5 questions that a functional medicine approach asks after a stroke that conventional care almost never asks. Each one of these points to a specific intervention that can support healing. Number 1, is chronic inflammation still running? After the acute phase, inflammatory cytokines like interleukin-1 and tumor necrosis factor alpha can stay elevated for months. If they do, they continue to damage brain tissue slowly. A high-sensitivity CRP test can tell you. Most discharge summaries do not include it. 2, is the brain getting enough raw materials to build? CoQ10, acetyl L-carnitine, omega-3 fatty acids, phosphatidylserine are all structural components of neuron membranes. None of them are in a standard post-stroke panel. 3. Are neurosteroid levels adequate? Pregnenolone, DHEA, and estradiol activate the sigma-1 receptor in brain stem cells, the pathway that turns dormant stem cells into new neurons. After a stroke, these levels typically drop. They are almost never measured. 4. Is the gut-brain axis contributing to inflammation? Systemic inflammation from gut permeability or microbiome dysregulation can cross the blood-brain barrier and amplify the neuroinflammatory response after a stroke. Diet and gut health are rarely part of the conversation. 5. Is the patient on anything that is actively blocking recovery? Statins deplete CoQ10. Some common medications interfere with B vitamin metabolism. A full medication review through a functional medicine lens can identify whether any prescribed drugs are working against recovery. Now, understanding these questions is the starting point, but the more important thing is understanding the framework behind them. Here's the two-stage model that organizes all the functional medicine's approach to stroke recovery. It's not complicated, but it's absolutely essential. Stage 1 is stop the destruction, the brain's neurodestructive sequence, the chain reaction of oxidation, excitotoxicity, and neuroinflammation. It has to be slowed or halted before rebuilding can happen. You cannot rebuild a house while the fire is still burning. Antioxidants, the anti-inflammatory support, the excitotoxicity management are the tools for stage 1. Stage 2 is rebuild. Once the destructive sequence is under control, the brain needs its rebuilding blocks. Cholesterol for cell membranes, CoQ10 and acetyl L-carnitine for energy, neurosteroids to activate stem cells, and omega-3 fatty acids for structural repair. Without both stages working in the right order, the recovery potential is dramatically limited. Most conventional protocols address neither stage in any systematic way, and that's the gap functional medicine fills. And the most exciting part of this framework is what happens when you actually do it right. I'm going to tell you something that is both hopeful and specific, because vague hope is not useful. Let me tell you what documented improvement actually looks like in this framework. Using EEG coherence, a technology that measures whether different parts of the brain are communicating with each other, we have seen something extraordinary. In patients who receive biochemical support alongside their therapy, new connections appear, new red lines on the coherence map where there were none before. That's not subjective. That's not the patient telling me they feel better. That's an objective measurement showing that the brain built new wiring. This is happening in patients who are years out from their stroke, not just in the first 6 months. The brain's stem cells are still active. The question is whether they have chemistry to do the job. So what does all this mean practically? What can you do with this information now? Whether you're a stroke survivor, a caregiver, or a clinician, here's the practical translation of everything I just told you. First, you do not have to fire your neurologist to pursue this. Functional medicine is complementary to the care you're already receiving. The goal is to add the biochemistry layer that standard neurology is not set up to address. Second, you can ask for specific labs that most doctors will order if you ask. CoQ10, omega-3 index, high sensitivity C-reactive protein, DHEA sulfate, and basic hormone panels that are all standard tests. Many doctors simply do not think to order them in a stroke context. Now you know to ask. Third, recognize that therapy and chemistry are not competing. They're partners. The physical and occupational therapy that challenges the brain to rewire is the demand side. The biochemical support is the supply side. Chemistry plus therapy equals function. If this helped you understand the biochemical side of stroke recovery, share it. Send it to someone who is watching a family member struggle and wondering why the progress has stopped. That conversation should change everything for them. I'm Dr. Lewis Clarke. The brain wants to heal. Let's help it do it.